This is an example of a prostate with benign prostatic hyperplasia, or BPH. Here you can see the prostate, and here is the associated bladder. BPH is characterized by nodular hyperplasia of the stromal and epithelial cells of the prostate, predominantly in the inner periurethral zone. So this area here. This is in contrast to prostatic adenocarcinoma, which is typically located in the peripheral zone in a posterior location. Compression of the urethra can cause urinary obstruction, leading to dilation of the bladder and muscular hyperplasia with trabeculation of the bladder wall. This bladder is dilated, however the trabeculations are not quite as obvious as some other specimens that you will see in your laboratories. Urinary retention is a risk factor for urinary tract infections. In BPH, the prostate is significantly enlarged, weighing 60 to 100 grams. A normal weight is about 20 to 30 grams. Grossly, glandular nodules are yellow-pink and soft, while nodules composed of fibromuscular stroma are pale gray and firmer. Once a specimen has been fixed, however, it is much more challenging to distinguish these two appearances. Microscopically, there is a glandular proliferation with cystically dilated glands lined by two cell layers.